Communication. We need to talk about the communication process, and it seems like you can just never get away from therapeutic communication when you're in nursing school. In one-way communication, one way to figure out the difference is one-way communication is more of a command. An example, it would be the surgeon tells the scrub nurse, "Hand me the number 5 dilator." The surgeon gave a specific order and did not expect any feedback. With two-way communication, an example would be the instructor asks the class a question about the topic being covered, and this purposefully prompts feedback or discussion from the students, if the students will open up and talk. Different personal characteristics of the sender and receiver are one of the factors that will affect communication. We have to look at age, gender, income, marital status, attitude, etc. With cultural characteristics, we're talking about how much space is between the two people, language, touch, manners, gestures, etc., because all of those things can have different meanings in different cultures. Situational influences include physical and emotional state, background noise, interruptions, etc. And context, the appropriateness or inappropriateness of the message can all affect communication. We know that there's 3 different types of communication. We have verbal, nonverbal, and affective. With verbal, how will the receiver interpret the word trip in this sentence? "I heard you had some trip." So, did the receiver of the message assume that they fell, that they tripped and fell, or that they went on a vacation? Or if we go back to the 60s, that they were taking some drug-induced trip? So, very easy to, even with verbal communication, to get the message mixed up. With verbal communication, we understand that this is a spoken message. You have to think before you speak. Make certain that you speak clearly, speak professionally, speak only about what you know. And if you don't know something, let the client know that you're going to find out the answer, or find someone who knows the answer, and then make sure you do it. Don't use slang, and don't use medical jargon. For examples of medical jargon, we assume that patients understand would be NPO. Well, how many lay people know what NPO means? Or sub-Q, or arrhythmia, bearing down, purulent. If you don't have some medical knowledge, those words may not mean anything. Understand that some clients, due to age, language barriers, or disease process, may take your words literally, especially children. Nonverbal communication. Some examples would be facial expressions, body posture, eye contact, hand gestures, fidgeting, yawning, sighs, shoulder shrugging, physical appearance, movements. Nonverbal communication is body language, and it can give clues as to the truth of the spoken message. They are also indicators of a client's discomfort, because they don't always tell us when they hurt, or they try and cover up just how much they hurt. Physical appearance is part of nonverbal communication also. Nonverbal communication pertains to behaviors displayed by an individual rather than his or her actual content of speech. A client's body language is going to tell you a lot about what a client may not verbalize. And then effective communication. That is the feeling or the tone of the message. So the tone of communication or the emission of energy if I were to say, the house is on fire, versus, the house is on fire, which one are you going to pay more attention to? Well, the one that has the more energy to it. There's many factors that affect a person's mood, such as traffic conditions, we all know about road rage, availability of parking. Dang, that person snuck in and got that parking spot that I was waiting for. How much sleep you've gotten, family situations, the mood of your coworkers, if you're hungry, if you have a headache, what your workload is, etc. Your attitude can affect your effective communication. The manner or disposition toward a person or thing. I've talked before about my Christian beliefs, and sometimes it can be very difficult when I see someone doing something that I feel goes against God's commands. I have to tuck all of that away and ignore my personal bias and make sure that I try not to show those feelings to anyone else. I don't show them to my client, and I treat them the same as I would treat all of my patients. Or a settled mode of thinking. Mood can also be a factor. Prolonged emotions that color one's psychic life. In personal space, if people get in my personal space, I find I have invisible walls going up and I want to physically push them away from me. It's that imaginary comfort zone that we all build around us. Some people require more personal space than others. But we have to realize that truly honest communication integrates verbal, nonverbal, and affective communication so they all express the same message, and understand that they can all occur at the same time. There's different communication strategies that we can implement to help make certain that our communication is attaining the appropriate purpose. Different key factors include the purpose, discipline, attention, and focus. In this instance, purpose refers to the health-related reason for gathering data or giving information. Disciplined attention means that you do not assume accuracy of information without checking it out. And focus means that all your senses are alert to clues that the patient may be communicating. Make sure that you listen to what is being said. And listening involves observing the verbal cues, the effective communication in addition to the words. Additional communication strategies. Make sure that you're familiar with these active listening behaviors. So let me give you a few statements. Try and figure out what type of listening behavior I am referring to. In this hour, you and I discussed blah, blah, blah. That's an example of summarizing. I'm not sure I follow that. Clarification. The patient states, "It's a waste of time to talk to anyone." The nurse says, "You don't think anyone understands?" The nurse is paraphrasing. Tell me whether my understanding is the same as yours. This is an example of validation. Go on. I see. This is minimal encouraging. The client states, should I have the surgery? And the nurse replies, do you think you should? This is an example of reflection. What can happen if you try and fill silence with chatter? Sometimes this just becomes empty words. It doesn't necessarily take the stress off the situation, but sometimes it may be appropriate. Make certain that when you are communicating with a client that you avoid interruptions and doing busy work while the client is speaking. So let's look at types of questions as communication strategies. With open-ended questions, these permit a variety of responses and allow the client to respond how he wants. And they often begin with what, where, when, how, or why. Close-ended questions require a specific answer, and focused questions provide more definitive information. So, what types of questions are these? What part of your body hit when you landed on the floor? It's requiring a specific answer, so it would be a closed-ended question. What happened when you fell? Well, you're allowing the client to respond how he or she wants to. That's an open-ended question. Continuing on with communication strategies, remember that you always have to evaluate the communication to make sure that it has conveyed or is conveying or is accomplishing the appropriate task or message. There's a lot of blocks to communication, different things that we do or portray that can actually inhibit someone from communicating the way we're looking for. So identify the following statements. What type of block do these indicate? So, what else do you dislike about your doctor? You're searching for information, so that's probing. Just keep your chin up. Come on, you can do it. That's providing a pat answer. It's bad to do that. That's chiding or scolding. I wouldn't worry about that. That's false reassuring. You won't die that soon. That's belittling. So what are some additional blocks to communication? Maybe giving approval or rejection, agreeing or disagreeing, challenging, testing, defending, requesting an explanation, using denial, interpreting, or introducing an unrelated topic can all affect or block communication. Now, there are differences in gender in the way males and females communicate, and you need to be familiar with those differences. In conversation, men tend to converse to maintain status, to report, to get information, or to solve a problem. They're more assertive and they use shorter and fewer sentences. If men are conversing, they tend to nod if they agree. Women, on the other hand, nod to show they're paying attention. Men hold their heads erect, and women tend to tilt their head to the side or lower their chin. Now, with smiling, women's smiles do not always denote happiness, and men don't always show emotion. Posture always will communicate nonverbally. Think about the differences in patient communication and the importance that can have on nursing implications. So think about how a man and a woman might answer the same question in a different manner. Understand that male opinions are often valued more highly without being validated. And I'm sorry, women, that's just kind of the way it goes. Patterns of communication may differ between people of the same gender, so it is important for nurses to make sure that they're asking detailed questions. Cultural differences, again, are going to play a big part in communication. There is a difference between a culture and an ethnicity. Culture is a total way of life of a people. It's a social legacy of norms and values the individual acquires from his or her group, where ethnicity is an affiliation due to shared linguistic, racial, or cultural backgrounds. Differences will exist within each cultural group, ranging from extremely conservative or orthodox to very liberal and reformed. And you really need to be aware of where your client falls in his or her cultural group. As a client ages or at different points in their life, we need to understand that there are role changes and understand that times can affect communication. For example, baby boomers that were born post-World War II through the 1960s and younger usually prefer to be called by their first name. But you don't just assume that, you need to ask that. Communication characteristics. These characteristics are important in all communications. Respect gives a client sense of worth. With honesty, never make up an answer if you're not sure of it. Again, let the client know that you don't know it, but you will try and find the correct answer, and make sure that you do that. With sensitivity, when you're sympathetic, as you would be with a family member or a dear friend, you are actually experiencing that emotion. Think about humor and when it's not appropriate. With patience, a lack of patience with a client can lead to the client's increased anxiety. Commitment. Why are you really in nursing? Self-esteem is earned, it's not learned. It gives you permission to recognize that you have something very special to offer in nursing communication. Random thoughts usually pass through unless you pick a thought and change it into an active thought. If your thoughts are not serving you, then you need to change them. Thoughts also set the tone for how you communicate with clients and other staff. And make sure that you are direct in your conversation and don't talk just to fill silences. Each age group is going to have different communication needs. Infants, for example, their cries have different meanings, and mothers are well aware of that. They are influenced by the sound of the voice. They tend to respond to calm, low tones. Newborns under a month old tend to respond better to high-pitched rather than low-pitched voices. Preschoolers cannot verbally express frustration, and that tends to lead to their temper tantrums. They communicate frequently by pointing, and if they are coached, they can help. So during procedures, explain briefly and simply what's going to happen and figure out something they can do to help. With school-age children, they can be part of many discussions. They can use drawings or pictures to explain an illness. Validation of the school-age children's perceptions is especially important. And remember that younger children think well in the afternoon time. Teenagers. Extend the same courtesy to a teenager as you would to an adult. Encourage their expression of feelings. Use of teen slang generally does not work out. Without really knowing what the meaning is, you may end up appearing foolish rather than cool. With the adult, collect data at all three communication levels. Limit the questions to the medical areas. Written information seems to be more neutral and does not evoke the emotional reaction that words do. So sometimes it may be more appropriate to use written information. And with the elderly, check which side is best for hearing. Now remember, not all elderly are hard of hearing. Make certain that you read directions aloud. And when you communicate with the elderly, be aware of possible diminishment of senses. Use a matter-of-fact yet gentle approach. Do not patronize or talk to them as if they are children. And include the elderly client in communication even if family members are there. With conflict resolution, you need to know the appropriate way to resolve conflict. These steps can help in that endeavor. Understand that conflict can be related to diversity. English is a second language, differences in gender, generation, and personality. Then apply these steps to resolve conflict. We do communicate quite a bit through electronics in today's age. We also need to be aware that there are appropriate methods of communicating with technology. Some additional email tips: make certain that you answer swiftly. Don't procrastinate. Answer all questions and try and avoid further need for questions. Do not attach unnecessary files. Do not overuse the high priority option. Do not copy or attach a message without permission, in other words, someone else's message. And don't use email to discuss confidential information. Remember, if it's on the internet, even if it's supposed to be private, it's basically public. And keep your language gender neutral. Try to avoid using the words urgent and important. With cell phones and text messaging, very, very touchy subject. When you're talking about your clients, etc. Realize, though, that many of the smartphones today can be very useful in the workplace. I've seen them used for interpreting, and I've seen them used for research. So make sure that you don't totally ignore the value that they can have, but understand that cell phones and text messaging have their place.